Namaskar. A very warm welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring you power of information, and that information will lead you to take charge of your health. Here we bring experts from Apollo Hospital where you can speak to them in the live session. And also, this live session gives you a chance of asking a question, posing a question to our expert. You can leave your question or a query in the YouTube chat box. You must be watching this on Facebook, you must be watching this on Instagram or other social media handles. But if you want your query to be answered, we request you to hop onto Apollo 24/7's YouTube channel and then leave your comment, your query in the comment section. I shall take these up and place it before our expert. Also on the show, we have a health quiz where you can win prizes from Apollo 24/7. And I'm going to give you discount vouchers and also coupons that you can use on Apollo 24/7. The app has everything that you can use, just like the entire system of Apollo hospitals. The app brings the convenience of consulting, buying medicines, booking lab tests, and keeping all your records at one place. So, chaliye, let's talk about the topic of the day. Today, we are going to talk about mouth cancers, all the oral cancers, mouth cancer, step-by-step guide क्या है, how do we survive this, treatment के बाद क्या होता है, all the options of treatment which are available, which are newer in techniques and advanced medicine. So we are having an expert here. Let me introduce our expert for today, Dr. Gopal Kumar, who is the robotic head and neck surgical oncology specialty से आते हैं, इंद्रप्रस्थ अपोलो हॉस्पिटल न्यू दिल्ली से, और सर का 15 years plus का experience है. He can be consulted for oral cancer, head and neck cancer, thyroid cancer treatment, etc. And ladies and gentlemen, let me tell you that he's the only surgeon to be trained in all 3 types of robotic surgeries, and the first surgeon to have an advanced fellowship in head and neck robotic surgery from Korea, and the member of Society of Robotic Surgery USA. And his achievements and awards range from Odla Guruba Sanman from 2023 award in Mumbai, gold medal in consultant award paper at AOI Delhi to 2014. He's conducted a research which is a clinical study of pre-malignant cases of oral cavity in 2011. Let me welcome Dr. Gopal Kumar. Sir, very good morning and welcome.
A very happy Sunday morning, Jhansi. Nice to be here along with you.
Thank you. Thank you. And it's so good to see, while I'm reading about you, the kind of work that you have done and the kind of achievements, the academic achievements and the treatment protocols that you have gathered to serve people. It's really an honor meeting you today, sir.
It's my honor also to be one among the many. But I think we are quite specialized and specified ourselves to very organ-specific treatment. And this is the need of the time.
Exactly. So जो हमारे पास statistics है, Dr. Gopal, which say that India has the highest prevalence of oral cancers in the world, and then it is the most common in men and the third most prevalent in India, after just followed by breast and cervix. अगर वो मैं gender निकाल देती हूँ, then it's the most common in the men. So the oral cancer is a pandemic. It's a time bomb on our head. There must be reasons. Is there any geographical specific reason to it, या हमारे आदत lifestyle ऐसा कुछ है?
As you must be aware, India has got a huge population of 1.4 billion, and we divide like our place. India is the North India, West India, East India, South India, and each of the parts of India has specific pattern of entertaining, like the men, the women, they get involved in the different types of habits, some at a later stage, some at an early stage. So some go for smoking, some have got chewing habits, some go for vaping, and many other forms of addictions that get used to in the growing age. And that has led to one of the most common cancer that we have, like the head and neck cancer. I think India leads in head and neck cancer, and the Southeast Asia itself is a continent which has got the most number of head and neck cancer. Among them, India, I think India is leading, and India is not only leading in the head and neck cancer, but it's also leading in the management and the treatment of head and neck cancer.
Wow, that gives us some kind of hope and positivity. So, while you say that we are leading in the treatment and management, I also have something here. अगर अर्ली डायग्नोसिस होता है तो हेड एंड नेक कैंसर्स में अप टू 90% का हम भरोसा दे सकते हैं. देयर कैन बी मैनेजमेंट अप टिल 90%. That is a big amount in cancer treatments, isn't it, doctor?
I would like to say, Jhansi, like the best part of the oral cavity cancer is that it can be diagnosed, or a person can become aware of a oral cancer on his own if he is self-vigilant. So if we, like, every day we brush our teeth, every day we see our oral cavity. So if we are vigilant, we can see if there are any changes that is present inside the oral cavity. A simple thing like we have got a pinkish mucosa inside the oral cavity. Someone who has got the mucosa is changing like to whitish one, or there is some growth, or there is some ulceration, or any other unnatural thing that a person feels that this is not the normal looking thing. I think he can come and get checked up with a doctor, and that's the first point or the first thing that we are able to pick up the cancer at early stage. So picking up the cancer at an early stage gives us a lot of plus points in the sense that we are able to treat the patient early. The chances of cure is pretty high. The way you say 90%, I would say like 90 to 95% for stage 1 cancer. Any cancer that has been picked up at an early stage, like early stage we mean stage 1 and stage 2 cancer, those chances are pretty high. And not only that, the cure rate, the treatment also is one sort of the small treatment that we can provide to the patient. He might not require any reconstruction. He might not require any long duration surgery. He might not require ICU stay. He might not require ventilator support for the first post-op day of the surgery. He might not require tracheostomy. He might require rise to feet for a few days only. He can get discharged on 4th or 5 days, 5th post-op day from the hospital. So the hospital stay is smaller, the hospital bills are smaller, early recovery, getting back to the normal routine, all of this helps not only to the patient, to the whole family, and to the doctor itself, no doubt.
Yeah. Cancer is mostly not just one person's problem. It becomes immediate caregivers and the family, and thereby the society's burden. It is always so. So catch it early and then get the treatments done. So while you were talking about early diagnosis, you were also mentioning the vigilant points that one has to take care कि इन पे ध्यान रखिए कि ये हो सकते हैं. So kindly tell us what are the cancers of the head and neck. Mouth cancer में क्या क्या हो सकते हैं? वैसे ये large है. तो हम सोचते हैं माउथ कैंसर. For example, if I say that I have breast cancer, I know breasts are present here and then I know where the cancer can be. But mouth is like कहाँ से कहाँ तक हो सकता है? Head and neck में कहाँ कहाँ हो सकते हैं?
So the interesting part is the head and neck. All the three important things that we do are related to head and neck. So if we are breathing through the nose, it goes through the then into the larynx and finally to the trachea and to the lungs. So if we are eating, that follows swallowing. Then it goes to the esophagus and then to the stomach. If I am speaking to you, the whole of my vocal cords, the throat, the soft palate, whole of my oral cavity, my tongue, they help me or assist me to say what I am speaking right now. So all the three main functions of the body are interrelated or connected to the oral cavity. So any person who has difficulty in any of these three things, he should get alarmed. he should go himself and raise it out to the doctor that I'm having this one. Suppose a person is having difficulty in swallowing, he might be having a base of tongue cancer, he might be having a upper esophagus cancer, he might be having hypopharynx cancer. Suppose there is change in voice that is persistent, say for 3 weeks, more than 3 weeks, 4 weeks, and that is gradually progressing, he should consult a doctor. And if there are change in voice, there is change in difficulty in swallowing, and what I have earlier said, like if there is oral cavity cancer, like there is ulceration over the tongue, a white patch in the oral cavity that is non-healing, and if there is loosening of the tooth, and there is no history of trauma or fall, and there is loosening of the tooth, deviation of the jaw. These are the pickup points that one should be very cautious about and get himself checked with the specialized person who deals with it.
Right. So we understand that it is not just one part which you have to watch out for. You have to start right from your gum line to the base of the mouth, to the roof of the mouth, to the tongue, and understand the voice changing. You also have to understand the swallowing difficulties. पूरा ध्यान जैसे you brush your teeth every day, very rightly said doctor, कि you are the easiest first gateway to understand your oral health. So what are
So,
the reasons that please doctor, you were trying to say something. Yes.
like, just one more point I would like to add, Jhansi. Like, it's not that routinely we have to keep on changing every day. Being a doctor myself, being a head and neck surgeon myself, I don't keep on checking my oral cavity. So one should be aware when to check. Having a bad habit of tobacco, and those patients are quite frequent. Like, if sometimes a small ulcer, a patient get panicked that I'm chewing tobacco, I'm smoking. So is this the ulcer? So anything for a certain duration of time, like a non-healing ulcer for 3 to 4 weeks, any lump in the neck that stays there for more than 3 to 4 weeks. So those are alarming signs. Those need to be checked. Those needs to be investigated. Those are not to be taken casually, like chala jayega. That attitude has to be, like, we should ask the patient or the people. They should be aware that casual approach to anything like that should be given away.
So, Dr. Gopal, while we say that you need to have a vigilant or have awareness on your own body and the changing symptoms, are there a specific group of people with specific kind of lifestyle or genetic or any other history or predisposition that they need to be more aware of than the other people?
So oral cavity cancers are not genetically related. Like, it's not that if a father is having a cancer, then the son also or the daughter also has got more chances of developing the cancer. Is the mainly oral cavity cancers are lifestyle changes that causes the cancer, along with other predisposing factors in a human being. So I think the habit of addiction, tobacco, smoking, alcohol. These are the for a prolonged duration of time. Decreased mouth opening because of these habits, and a poor immunity, uh,
So,
poor
decreased
ability of
mouth
your body to
openings,
fight
kya hai,
off.
sir? What are the decreased
So,
mouth openings?
so normally our we can put our four fingers individual. Like, my size of the fingers may be different for other, but if I put my four fingers, I think I can enter into my oral cavity. This is a normal mouth opening that we have. Suppose a person who is chewing betel nut, areca, pan, tobacco, canny, so that causes oral submucosal fibrosis. It causes our mucosa to change. So we lose the elasticity of the mucosa that we have. So it becomes more like a fibrous tissue, like a rope. It's not like a rubber that we can extend. It's become more like a rope. So they keep on decreasing, and our mouth opening keep on reducing. Like, from 4 fingers, it will to 3 fingers, then to 2 fingers, and then to 1 fingers. And some patient or They don't have a complete occlusion of the mouth. So these changes are initially they are slow, but with time it becomes radical. They they become very progressive. And those patients, if they have any new development inside the oral cavity, they won't be able to appreciate that. So that's a sign when again you should consult your treating doctor.
Great. So, doctor, while you were saying, you also had mentioned कि smoking or chewing tobacco is the reason and the primary reason. I see that here that's the major culprit, either chewing or smoking tobacco. So, persons with history of how many years? Because there are most of my friends who say, yeah, एक सिगरेट पी लिया कुछ नहीं होगा. I just touched it just for fun. मुझे कुछ नहीं हो सकता है. Is that so कि somebody who's been with tobacco or chewing tobacco or smoking tobacco for a very long time, only they are susceptible for mouth cancers or lung cancers? Or is it just fun के लिए एक बार किया था उसको भी हो सकता है?
So what we say or what we believe is that 70 to 80% of the oral cavity cancers are caused by tobacco in any form. What we have not been able to justify or prove till now how much quantity of tobacco is required to cause oral cancer. So even if you go through all the data and every books you read through, no one says how much more. We classify it whether a person is having 5 cigarettes a day, or whether a person is having 10 cigarettes a day, or whether a person is having 50 cigarettes a day. So that may make changes. It may, if a person is prone to develop a cancer, which we don't know which cancer is patient is going to develop a cancer, which person is going to develop a cancer. So if a person develop cancer, in the history we always mention that this patient was having a consumption of like 5 or 10 cigarettes per day for the last 15 to 20 years, and now he has. So those documentation helps us in profiling the patient. Like this patient might not only develop one cancer, he is very prone to develop more cancer. Even if we treat him for the first cancer, then also he has to be very vigilant for in the follow-up. He will require like more stricter guidance or more stricter checkups, because he is very prone to develop second cancer also, which we call that as second primary. Or there are high chances that this patient can have early recurrence or sometimes late recurrence.
Right. So here I would want to bring a personal question. I have a person who is helping me in my domestic chores. So she has been chewing tobacco, whatever the contents of the packet do have tobacco, and she's been chewing it for almost 28 years of her life, 28 to 30 years of her life. Very young that they started. She comes from a very small tribal area from Chhattisgarh. So which बड़ी मुश्किल से with great difficulty the last 4 years से we made her stop, gave her all the patches, helped her to chewing gums, etc. We made her stop doing this. Now I'm aware, I'm watching out, I'm telling her that कि आपने बंद कर दिया, but still you are at risk. So how long does one need to monitor कि आपने जो पहले all the symptoms that you narrated, how long one does need to be vigilant?
So usually we say like 15 to 20 years, but in some
After
cases
stop.
maybe for after stop. Yeah, they say that it can cause or it can promote generation of a like development of cancer after 15 to 20 years also. But it's not only, that's what I told you, like head and neck cancer is a lifestyle cancer. So with 15 to 20 years, the tobacco is not only the common cause, or we can't relate to that, but there are other things in 50 to 20 years. She will be like around 60, 65 years of age. There will be other changes that may have occurred inside her body, which we will not be able to appreciate. And that can also lead to cancer. But of course, with such a long history, with such a long duration, she has to be vigilant. Like, of course, I would say like 15 to 20 years, anytime in between, she can have the cancer.
Right.
those
So
chances.
one has to be vigilant even after this after you stop or quit tobacco. One has to be vigilant. That's something which is alarming. कि आपने आज बंद कर दिया तो कल से आपको कुछ नहीं होगा. That's it's a very wrong way to understand tobacco and its
That's
side effects.
that's a absolutely, and that's why uh, every time we treat a patient, I think we always ask the patient to advocate. They are the best person to, or best ad man to go back to the society among the normal human beings and say that leave it, yeah, this can cause a
Yeah.
disaster.
Yes, two things that after your observation that one who has gone through the entire ordeal is the best person to talk about it. Two things मेरे दिमाग में आया है सर. First and foremost कि हमारे advertisements जो है जो हमारे people who have gone through cancer or treatment जैसे फिल्मों में दिखाया जाता है, we have these advertisements on tobacco. We make fun of them. Entire theater sits in the group and कोई मुकेश आते हैं, one lady comes who says मैंने बैंगल बेच दिए हैं. So we do make fun of them. So it is not so culturally हमारा tobacco chewing इतना ingrained है that we have cultural practices in tobacco, and then we're not talking about the side effects of it enough.
So
Which I think please continue.
I think we have taken sincere and generous step regarding this. Whether it is Tata Memorial Hospital, because it's the leading hospital that deals with um, the more number of cancer cases, or whether it's the government, or whether there's the general public, whether it is you, it's me. So everyone, we are very sincerely propagating that it's a preventable disease. So if we stop tobacco in consumption in any form, I think we won't face this lot of patients that we are treating right now. So
So
better to
tobacco
stick to
consumption.
it.
Yes. So there's a lot more awareness and campaign that should be running around it, that tobacco is the direct link to head and neck cancers. So the other question that led from the last question was, while I was helping my domestic help, she kept on saying that, Amma, no అనవసరంగా కంగారు పడుతున్నావు in my language, that you are unnecessarily panicking. It doesn't come to women. This cancer doesn't affect women. This cancer जो खाते हैं, जो सिगरेट पीते हैं, वो only मर्दों में आता है. That's her saying. Is it true that men are the only people who are affected by mouth cancer?
No, it's a myth. It's a pure myth. The mouth cancers are more common in men. If you find it out in a ratio, 1 in 5, like 1 in 5 patients are the female. So if we are treating 5 patients, male patients, one among them will be the female. Because the chewing or the tobacco habit is less prevalent in the female group as considered, we find a less amount of female patients. But these trends are changing because of the changing habit, changing culture, changing dynamics of the society. So I don't
We
want,
are
because
seeing a lot of women taking to tobacco in the form of, I'll say that there are working class of women who are always on tobacco chewing. कुछ भी substance होता है, so they are chewing tobacco, and then there is another class of women, for whatever reason that they want to look good, cool, lose weight, or whatever reason that they want to give, they are taking to smoking. So tobacco consumption in women is also going really high, Dr. Gopal.
true, very true. And they are already known for other cancers, but with the occurrence of head and neck cancers among them, we are seeing a lot of patients these days, no doubt about it, who are female. And I would say that the good society, well, a good status is not only about the low, like you said, the domestic health of your house, any other person, but all of them, to all general reaction to all gender, like from low to high, everyone is prone to develop cancers.
All right. So it's women or men, you are prone to if you have a smoking or a tobacco chewing history. So I have two questions from our audience who have joined. There, many greetings to you and many congratulations to you as well. But in those, I do find
Thank
two
you.
questions here. One is Mr. Anil Kumar and the other one is Purna Pragya. First, I'll take Anil Kumar's, which isn't mouth cancer, but it's a nasal carcinoma. Anil had undergone nasal carcinoma treatment in Apollo itself. Both radiation and chemo are done. Now PET scan report is normal. What is the way forward? कि एक बार इनका treatment हो चुका है. So what does he have to do?
So, depending upon which type of nasal carcinoma, once he is being treated and he has got his PET scan done, so he has to be with the treatment protocol that we follow, like every 2 months in the first year. After the first year, there will be other, the second year again, he will undergo PET CT scan. Then every 3 months again for the second year, and in the third year again he has to go for, like, every 4 months he has to go for the checkup, the routine checkup. So for the next, I think, is the clinical examination. Then in OPD basis, we do clinical examination, we do nasal endoscopy to see things. If everything is fine, there are certain things that we ask the patient to be aware of, like bleeding from the nose or nasal obstruction or anything that causes difficulty in breathing. So these are the signs and symptoms. And by this time, I think Mr. Anil must be quite aware of all these things and what he has went through.
So, Doctor, next question is from Purna Pragya. Hello, doctor. Please clarify whether mouth cancer affects one with tobacco chewing habits only, or would it affect elderly women who have no chewing habits also? Thanks in advance.
Very true. Like, it's not only the person who is addicted to tobacco develop oral cancer. I'm again stressing it's a lifestyle disease, and because of the increasing longevity of our life. So in the pre-independence era, by the independence era, a patient life expectancy used to be 45 years, maximum 50 years. But today, with good healthy habits and all those things, our life expectancy has increased to maybe 70, 75. Generally, most of us stay alive till 70, 75, maybe 80, 85. So in these patients, there are many other genetic alteration or degeneration that can happen, and that cancer. So, of course, these patients have a chance that they don't have any history of tobacco addiction, and they can develop a cancer. And they are a very tricky patient to treat because they are more on the fragile side, and they can't sustain also, even though are healthy, hearty, they can't sustain long duration of surgery, because 75 patient taking for oral cancer, big cancer surgery is itself a very deterrent factor. Slow recovery in them, slow healing in them. So these are the challenges that one faces if they unfortunately develop a cancer.
Right. So with that, doctor, that reminded me of one of our my niece's in-laws. The gentleman never had a history of tobacco in the form of smoking or chewing, but then they thought it was a dental problem. He thought it was a dental problem, but unfortunately it was a cancer in his oral cavity, for which he had gone for a surgery in Mumbai. And then he's fine now. He works in a very reputed organization of the Indian Government Service. So he, as you said, he's become an ambassador, saying that, boss, मैं सिगरेट नहीं पीता था, मैं टोबैको तंबाकू कुछ छू नहीं करता था, मेरा पान मसाला, पान, बीड़ी, not even palm that I used to eat, but I did have oral cancer. So he spotted it on really very early. They thought it was a tooth kind of dental kind of issue, and then the dentist was the first point who said, this does not look like a dental issue. Can you please continue investigations? So what is the role of the dentist as well in identifying oral cancers?
So I would say like more than 50% of the oral cavity cancers are seen by the dentist. If they are more aware, like how to pick up a cancer, I think they can pick it up very early. So we commonly have dental problems, and we go to a dental surgeon for various reasons. So if they say that there is a group something, there is very unnatural type of thing they haven't seen. I think they can simple ask the patient to visit the specialist who deals with the head and neck cancer, or if they are like they have got the expertise in head and neck cancer or training in head and neck cancer, at least they can do a simple biopsy, which is a small procedure that can be done in the OPD basis under local anesthesia, that with no side effects as such. And we do have the report within 24 to 48 hours in some cases, and then we can take ahead from there itself.
Right. So with that, I think I should talk about how do we diagnose these. जैसे मैं vigilant हूँ, I am aware of my body, the symptoms, and then I go. But what are the tools that you said? Like biopsy is a question which could be asked for diagnosis में. What are the other tests? अगर कोई lab test है या कुछ और, what are the ways that you diagnose this?
So, in our terms, we say that we don't have any biological marker like type of things. Suppose for a GI, we have got like C99 and all those markers
Yeah,
that
all the
we
same
can
markers that you have,
simply.
124, 125. Yeah.
Absolutely, absolutely. And but unfortunately for the head and neck cancer, we don't have any biological marker. Like with a simple blood test, we can't say that the patient is having a cancer. So only biological marker that we have is for the thyroid cancer. So that biological marker also not helps us in diagnosing the thyroid cancer, but it helps us in follow-up after treatment. We do thyroglobulin test, and on that serum level of thyroglobulin, we say the patient is having, whether patient is completely cured or whether patient is going to have recurrence. So, but oral cancer, we don't have any biological marker. So, what test first we advise to the patient is a simple tissue test that is called biopsy. Or if there is a lump or a swelling in the neck, we ask the patient to undergo FNAC, fine needle aspiration cytology. That can be done very well done in the OPD procedures. So, but the concern of our patients is that if we do a biopsy, the cancer will spread. That's a myth or that's a belief, and this is being like it's become hard for us to explain to the patient that we need a tissue diagnosis because our treatment is dependent upon that. So there is not only when you say cancer,
So
cancer is a broad
where
term.
do you think, doctor, that this myth is कहाँ से निकला होगा ये myth कि कैंसर है तो we all understand that कैंसर का जहाँ जहाँ एरिया है उसको निकाल के बॉडी से दूर किया जाता है. That's one of the first line of treatment that we've been known for ages. सुश्रुता से लेकर अब तक modern medicine that we know that रण जो होता है we call that रणम बोलते हैं हम संस्कृतम एंड तेलुगु में. So अगर कैंसर है तो कट कर दो is the answer that long ages से आया है. तो ये बायोप्सी से स्प्रेड होता है, ये कहाँ से फैला है? Where do you think the myth is originated from?
Now the thing is that मानना ये है कि कैंसर को छेड़ोगे तो ये बढ़ेगा, ये कॉमन.
तो छोड़ोगे तो भी बढ़ेगा ना डॉक्टर.
ये चीज लोगों को समझ में नहीं आती. ये चीज लोगों को समझ में नहीं आती क्योंकि बायोप्सी इज लाइक ए छेड़ना फॉर ए पेशेंट. मैं उसे रखा हुआ हूँ तो मैं उसे छेड़ नहीं रहा हूँ. दैट पेशेंट बिलीव कि ये बढ़ नहीं रहा है. But after the biopsy, the more major problem that we do face, suppose I am at a periphery, I am a tertiary care center. I get lots of patients from the periphery, from different parts of central Delhi, central India and North India and other part, eastern region. So they get the biopsy done. They'll go back to home because uski result 48 to 72 hours में आएगी. Doctor, we will get back to you. The patient never turns up. वो जब आता है तो वो शायद महीने बाद आएगा, 2 महीने बाद. Obviously, the cancer has got an inherent tendency to spread. वो बढ़ेगा, उसकी फितरत है वो बढ़ने की. आप कुछ ना करो तो भी बढ़ेगा. जब आप बड़ा सा ग्रोथ लेकर के आते हो कि मतलब वही बड़ा सा ग्रोथ started from here. It must have started from a small, minuscule, like 1 centimeter lesion.
Mustard seed, हाँ.
Absolutely. और जब आप पेशेंट को बोलोगे इतना कैसे हो गया, कितने दिनों से, सर 15 दिन से, इट्स नॉट 15 दिन, इट्स लाइक 6 months। आपने अपने घर वालों को नहीं बताया, आपने अपने घर वालों की नहीं सुनी कि चलो डॉक्टर्स को ट्रीटमेंट देते हैं, जाते हैं, देखते हैं, बात करते हैं। और जब ये चीज आपके कंट्रोल से बाहर हो गया, नाउ यू आर फेसिंग द प्रॉब्लम, यू हैव कम फॉर द ट्रीटमेंट। So the window period we have missed. Instead of treating you as a stage 1 cancer in which the cure rate is 90 to 95%, I am treating you as a stage 4 cancer in which the cure rate is 60 to 70%. Apart from that, in oral cavity cancer, in stage 2, perhaps you might need only one type of treatment, like the surgery will be enough for you. आपको रेडिएशन, कीमो, ये सारी चीजों की जरूरत नहीं पड़ेगी। बट इन एडवांस कैंसर यू हैव टू might undergo all the 3 treatments, not all the 3, but surgery और रेडिएशन तो मस्ट हो जाती है फिर आपके लिए। Just I would like to say that a cancer patient is not a day treatment. एक ट्रीटमेंट
हाँ.
कंप्लीट होने में it takes near about 6 months.
Yes, that was
6
what I
months.
would wanted to ask you, because step by step हमने बोला है कि ये मुझे समझना है कि ट्रीटमेंट क्या है। But first and foremost, let me hold up a banner on behalf of you कि बायोप्सी से मत डरिए। Let me tell all the people, in case that your doctor is suggesting you a biopsy, a tissue culture, or an investigation of something that is growing within you, please go ahead and get it done. डरिएगा नहीं, कैंसर उससे फैलता नहीं है। So that is a first step to diagnose your cancer. Now coming to treatment options,
Yeah.
Dr. Gopal, I see that you are one and only person, the first one to be surgeon to be trained in all the 3 kind of robotic surgical procedures. May I understand why these robotic surgical procedures, the precision matters, are very important in oral cavity cancers? And then can you please explain the newer treatments which are available?
So the robotic thing that has developed these days in the head and neck cancer, and why we advocate getting a robotic surgery done, is not the routine thing that we perform in each and every patient. There are specific class of patients who requires robotic surgery. Initially, ये जो concept है, it started in Korea because the Korean people are very adamant that we don't need a scar. And in a head and neck cancer, the facial appearance is the first priority of the patient. If you get a cut on the face, no one likes that. If you get a cut on the neck, people don't like it. So some people ask that, is there is a probability that I avoid the scar? But you can't avoid a scar, but you can conceal a scar. Like instead of giving the scar in the front of the neck, it can be a concealed. You can take the incision or the scar behind the ear inside your hairline. So it will be a concealed one. It won't be visible to the patient, not to the outside. And patient do feel good about it. Yeah. But there are specific category of patients. Those they are to be treated by robotic only. Like it has proved very beneficial in them. Like the oropharyngeal cancer. Like I told you, like the oral, the anterior portion of the mouth that you are able to see, and the thing that is beyond that is the oropharynx. So it's not normally visible to a patient. It has to be, and those cancers are also very prevalent in India. So those patients are usually treated with, not with surgery, but with chemo and radiation now also. But any cancer do have a tendency to come back, revert back. So after treatment, if the patient have a recurrence, like again he developed the cancer at the same site, like that is beyond the normal oral cavity or beyond the tongue, like the tonsil, the hypopharynx. So to treat those patients in the initial stages, we had to cut open the mandible, we had to split the mandible, take out the tongue. That was like doing a very morbid surgery. मतलब आपने सारा कुछ patient का छेड़ दिया. The only advantage of robot in such cases is that We don't have to interfere with any other parts of the body. We don't have to make any cut over the face, over the tongue, over the mandible. So the robot, they are the instruments goes through the oral cavity, through the natural orifice, and we do the surgery. So is the surgeon does the surgery. The robot only assists. Is the doctor who operates the robot. It's not that the robot does
Right.
the surgery on its own. That's the first thing
I
that
know
we should be aware of.
we एडवांसमेंट्स और टेक्निकल एडवांसमेंट्स तो काफी हो चुके हैं, पर हमारे यहाँ अवेयरनेस एडवांसमेंट्स भी होने चाहिए कि रोबोटिक सर्जरी बोलो इज
बिल्कुल
नॉट the robo which is doing the surgeon is doing the surgery with the help of robotic tools. So that is one basic clarity that we would all want to give you. So one basic question again, anytime reiterate karna important hi hai. So though we've talked about it, Tapan Jyoti Biswal is asking, what are the symptoms of gum cancer, jaw or teeth?
So any bleeding from the gums, that the most common bleeding is because of the gingivitis, the oral gum problems that you do have. So any loosening of the teeth, like suppose at the age of 40 you are having of the teeth unprovoked, of trauma, कहीं से आप चोट नहीं लगी, कुछ मारधाड़ नहीं हुआ और आपके टूथ अगर लूज हो रहे हैं, so that's a very provoking symptoms that you need to take care of it. You need to get yourself examined. That is very true. Any growth over the gum, whether inner side or the outer side, that is non-healing, you have to go. So signs and symptoms more or less remain the same for the oral cavity, whether only the site of the oral cavity do varies. Like it's the buccal, it's the tongue, it's the jaw, it's the upper hard palate, the soft palate. So you will feel the unusual things that can happen and you have to take care of it.
Right. So treatment options may, once you've diagnosed or understood that one has any form of mouth oral cancer, what are the treatment options? जैसे बाकी cancers के हम सुनते हैं chemo radiation वो भी है, and what are the surgical procedures? Step by step, please.
So will be very brief. I would like to say surgery remains the mainstay of treatment. ये सबसे पहला एंड सबसे बेस्ट ट्रीटमेंट है फॉर ओरल कैविटी कैंसर. ओरल कैविटी कैंसर के मुंह के कैंसर का जो कैंसर की सर्जरी हो सकती है, दैट वुड बी द बेस्ट ट्रीटमेंट. इससे कैंसर पूरी तरह से निकल जाता है. We are able to get a detailed report about the cancer, like the Janam Patri. Every person has got a kundli that we say, like यार इस बंदे का कुंडली देख लो, or we match the kundli. So histopath report is more like kundli of the cancer. Like we know which type of cancer patient is suffering from, how aggressive the cancer is, what's the dimension of the cancers, and whether the patient requires further treatment or not. Even clinically, मैं जैसे बोल the simple term, stage 1 or 2 cancers, most of the patients only require surgery. But sometimes after the histopath report, we have to change these decisions and the patient might require further treatment, that may be radiation. Because if the cancer is aggressive, we need to go for the further treatment. And that's how it helps.
Right. So there are progressive treatments which are need based and then case basis that you go ahead. Recovery का क्या chances है, and then what are the kind of timelines? For example, somebody's gone through at a very beginning stage. उनकी recovery and recurrence के chances क्या है?
So the recovery process of a patient depends upon the normal general well-being of the patient, simply. So if the patient is smoking, so we ideally say that the patient should quit smoking at least 2 to 3 weeks before he undergoes the surgery. But that is not possible every time. So early cancer, we have to do a small surgery like simple and excision, जिसे हम निकाल देते हैं with 1 centimeter margin. We don't have to cut the bone, or we don't have to chop off the whole overlying skin, or along with the neck dissection, जो lymph nodes हम निकालते हैं. In those patients, the recovery time is within 5 to 7 days. So they are fit to be discharged. Yeah, they are fit to be discharged within 5 to 7 days. They get discharged from the hospitals. That's the only time. The recovery time that to get back to work, like once the sutures are removed, जो टाँके लगे होते हैं, we take it out within 10 days or 14 days. Once the sutures are removed, then we ask the patient to undergo some rehabilitation. Suppose some cancers, we ask the patient to undergo speech therapy or swallowing therapy if required. We, we do a neck dissection, then we ask the patient to go some shoulder exercises, hand exercises, neck exercises, and I think the patient can be back to the society to his routine thing within 3 weeks of a small surgery.
Yes. So recurrence is a big nightmare in cancer. We understand that कि cancer एक बार we've got it treated, it is not 100% a treatment. There is still a chance or a fear lurking behind. What is the scare in mouth cancer?
So, with more number of cases being diagnosed, more number of cases being treated, and good treatment option that we have, we are curing patients as per the stage that I have already said. So, those patients who are cured, they do have chances of getting recurrences depending on the habit status that you have, or some again get back to the normal drinking habits, the smoking habits after getting cured. कि डॉक्टर अब तो मैं ठीक हो गया हूँ, मैं स्मोकिंग कर सकता हूँ. एंड इवन दे लाई टू द डॉक्टर ऑल्सो कि नहीं मैं स्मोकिंग नहीं कर रहा हूँ. फिर फैमिली मेम्बर्स बोलेंगे कि ये नहीं ये करते हैं, इनके मुंह से स्मेल आती है जब ये घर वापस आते हैं. So these habits of the patient obviously put him in danger, like they have got chances of high recurrences. And once the recurrence do occur, it's not, again I would like to say, it's not the end of the road. Obviously, it always becomes difficult for the doctor to treat the patient with a recurrence, but the recurrence disease also can be treated well. But obviously,
Okay.
the survival that we are expecting for a normal patient is way far behind for a recurrent patient after treatment.
Right. So, अभी मैं थोड़े I want to go through the cultural facts in having tobacco as a part of culture. I come from Andhra Pradesh, from the district where tobacco is grown in export quality in huge numbers, that is Guntur, जहाँ tobacco काफ़ी popular है. So हमारे region में, the belt at Krishna Godavari and then the northeast of Andhra Pradesh, we see a lot of people believing that अगर आप pure, organic, that good smelling tobacco अगर आप खुद roll करके आप पीते हो तो आपको कुछ नहीं होगा. This is all the cancer is all the industrial tobacco manufacturers thing that they created. Anything जो nature से आता है वो organic है, कुछ नहीं हो पाएगा उसके साथ. Is that true?
No, no, not at all. The thing is that the more filtered thing that you are taking, they do filter the not the carcinogens. They filter the things that inhibits you from taking them, like the pungent smell. They give you a flavor that you can consume more. But the carcinogens, that those are the normal ingredients of the tobacco. So the tobacco
कि आप
effect
उसको natural
is because of the
दो लीफ को रोल करो या लीफ को पीसेस करके सिगरेट में भरो, खुद रोल करो या इंडस्ट्रियल रोल करो, टोबैको इन नेचर इटसेल्फ हैज दैट.
it is a carcinogen. We say that it's a carcinogen. So it's not only a single component that is carcinogen. In tobacco, we say that there are 80 to 85 types, different types of things that can be present. And it's not only कि आप एक तरह का खाते हो, आपने ये भी मिला दिया, आपने वो भी मिला दिया. Like in Gujarat, people are very fond of like supari. They roll it mixture, like 10 different types of mixtures they use, put it in a thin paper, they will just scrub it over the palm and they will have it. And if you're standing, you can smell them from a kilometer. It's like such a smell is that. And they keep it invariably every time inside the oral cavity. And those are like really dangerous. Like जैसे आपने कहा
तो
कि
ये
फ्रॉम आंध्र प्रदेश these are the-
हार्मलेस सुपारी की तरह लगता है सर, हार्मलेस बीटल नट की तरह लगता है जो हम लोग पान में डालते हैं, चूरा करके खाते हैं, या होल नट इन नॉर्थ ईस्ट, अकॉर्डिंग टू वन ऑफ माय फ्रेंड इन नॉर्थ ईस्ट, बच्चों से लेकर दे थिंक कल्चरली इट इज ओके टू चू बीटल नट बिकॉज इट्स नॉट लाइक स्मोक.
That's the most dangerous part of the betel nut, areca nut, because it has caused erecholine, and erecholine itself is a carcinogen. जो मैं माउथ ओपनिंग कम होने की बात कह रहा था, it's mainly because of the areca nut, because that causes a vicious cycle. Once the cycle or the process get triggered inside your body, you are not aware कि ये चीज मेरे में होगी या नहीं होगा. तो ये आप लोगे, आप लिए आपके it doesn't suits your body. In the suits your body in the general term that I would say that your body is behaving erratically to the component. Suppose आपके मुंह के जो pinkish mucosa है, जैसे मैंने कहा, it gets turning white. That you lose the elasticity. आपकी mouth opening कम होते जा रही है. Now you have triggered the vicious cycle. So even if you stops, वो सर्कल जो है वो चलता रहेगा, वो चलता रहेगा, वो चलता रहेगा. It's not going to stop.
Yeah, yeah.
So if
So
you have got a
please continue, doctor.
please no, if it is only your body ability to fight that. There is no medication for it. If a doctor says, "Hey, आप ये दवा लो," like we give antioxidant, but there's just like a passive fact. मतलब they doesn't have any specific role. It's nowhere proven कि हम antioxidant लेंगे तो वो चीज रह जाएगी, चुप हो जाएगी, बंद हो जाएगी.
It is
Nothing
like
like that.
accelerate करते हुए ब्रेक कर रहे हो, क्या फायदा? एक तरह से गाड़ी आप एक्सेलरेट कर रहे हो और फिर ब्रेक भी मार रहे हो, so it's the same thing.
So better not to start it, not to have it. So I think
Right.
that's the best way to
Right.
get
So
rid of it.
let me come to the modern angle of it. मैं cultural, geographical, other regional specifics में बात कर चुकी हूँ. Let me come to the modern angle of the electronic cigarettes or vaping or the newer generation materials which do have tobacco in a very different form. So what is the impedance? What are the implications?
So this vaping and these things was a Western culture. Like they do started with the vaping, the e-cigarettes that we say, because the cigarettes is not allowed in Europe or in US. If you see, uh, they have got like certain age group before that you can't smoke. So this was developed to promote smoking in younger age group. Now the younger age group start vaping at a quite early stage. You are predisposing yourself to these toxic effects of the vaping at an early age group. Now it has got more harmful effect than they say. अगर आप ई सिगरेट्स की बात कर रहे हो, आप वेपिंग की बात कर, they say that it's like act like a filter. It's not at all. The smoke that you inhale the carcinogens along with it, and it has got similar implication as any other tobacco thing that you have.
Okay, so it's the same thing. It's the same thing in a very different way. So beware. Just because it is packaged new, just because it is not showing the smell or the smoke of tobacco, it doesn't mean that it doesn't have the negative impacts of tobacco. Let's all be aware and take
Absolutely.
care. So one last question from our audience for today is Ajay Kumar ji's question. Can head and neck cancer spread to the chest or any other parts of the body?
So unfortunately, any cancer has a tendency to grow, has a tendency to spread. So any cancer can spread to any other part of the body. So unfortunately, if a head and neck cancer travels beyond the neck that we commonly say, so it can from the oral cavity it can down to the neck. In the neck there are lymph nodes. They can be enlarged, they can get involved. Then also the patient is treatable. Like we can treat the patient, there are high chances of cure. So if it travels beyond the neck, like if it travels beyond the neck, from the neck to the chest, unfortunately to the lungs or to the liver or to the bones, then we say that it had metastasized, like it has spread all along the body. So there is no cure for it. There is no cure for it. We don't treat the patient with the intent to cure it. We just want to control the disease. we want to stop. We try to put a brake on its spread so that it doesn't deteriorate the patient life. So the treatment thing changes, the intent changes, and I would say that there is no cure for it at present from the medical fields. So it can't be cured
Right.
at present. Yeah, we do aggressive surgeries and all those things, but not not very hopeful in a sad way. Not
Yeah.
very hopeful in a sad
Metastatic is a very very difficult one to treat, which we have understood for
treatment.
so
Absolutely.
long. इतनी हिस्ट्री में हमें समझ में आ गया है. बट देन ओरल कैंसर हो या कोई और कैंसर हो, कैंसर का एक ही मंत्र है: catch it really young, catch it really very early. Diagnosis is the key, and that's leading to a better survival rate and a better lifestyle rate. So, Dr. Gopal, thank you so much for joining us. But before you leave, I would want you to reiterate on the factors of management of mouth cancer. So, if you can just give us top tips on management of mouth cancer.
So get yourself diagnosed, get yourself treated. Treatment is simple, might not be simple for you, but if you get diagnosed early, of course, the chances of cure are high. Surgery remains the mainstay of treatment, but there are other cancers that can be treated by chemotherapy and radiation, like the voice box cancer, where preserving the voice is of utmost importance, and they are treated with chemo and radiation, and they have got almost equivalent chances of cure like the surgery with preserving the voice. So after the surgery, you might require adjuvant treatment like the radiation, which is usually of 6 weeks duration. You have to take radiation every day, 5 days a week for 6 weeks, when it has been decided by the radiation oncologist, which are completely different from the surgeons that who operates on you. Sometimes, along with the radiation, you might require a single agent drug, like we call it for the chemotherapy, that helps in potentiating the effect of the radiation once the radiation is over. So you have to rehabilitate yourself after the completion of treatment. I would say it's a long and tiring journey for any patient, but you are not alone. Your family members are there with you. We are there with you at each and every step of your treatment. And there are
Wonderful,
pretty.
doctor. Yeah, you're continuing something, please.
Yeah, so I would say don't, that is common thing that I speak in every talk of mine, like don't run away from cancer, don't hide a cancer. Say to your family member, discuss your problem, come to a doctor, get yourself treated. The doctor
Great.
is there to treat you, to cure you. He is there to fight for you, fight with you.
Wonderful. Social stigma is something that is a deterrent in cancer treatment, which stops people from reaching for medical help. So, very rightly said, please discuss it with your loved ones and family members so that they can support you in battling the cancer. And there are such wonderful doctors and institutions like Apollo, which can be the partner in battling cancer. Thank you so much, Dr. Gopal Kumar, for your time on this Sunday morning. Appreciate your time.
Thank you, Thomas. Love to be here.
So
Thank you.
much. So here we take leave from Dr. Gopal, and I continue to do the health quiz. 3 questions coming up. I'm going to announce the winners towards the end of the show. Winners will be selected at the sole discretion of Apollo 24/7 team. And if you're taken, if you're considered the winner for this week, I'm going to announce you, and then you have to write back to us before Wednesday of every week with all your contact details at marketing@apollo247.com. And the gift vouchers will be shared with you. And the questions for today, that is the 15th of September, are the questions on the screen. Question number 1: smoking or chewing tobacco is the most common risk factor for mouth what? C से शुरू होता है, please fill in the blanks. C blank N blank E R. Smoking or chewing tobacco is the most common risk factor for mouth what? The blanks. C blank N blank E R. Question number 2: oral cancer is a problem only for men. Myth or fact? Oral cancer is a problem only for men. Myth or fact? Question number 3. A sore in your mouth or a blister in your mouth that does not heal is usually a sign of mouth cancer. True or false? A sore or blister in your mouth that does not heal is usually a sign of mouth cancer. True or false? These are the 3 questions for today, and I request you all to type the answers in the chat box of the YouTube channel of Apollo 24/7. And here are the coupons that you can use on Apollo 24/7. The first one that we are giving away today is AskDoc150. Use this code to get 150 rupees cash back on online doctor consultation. And the next one that we are giving away today is FIRST3, FIRST3. Use this code to order medicines direct from Apollo hospitals, and then 25% off on online medicine orders as well. The next one that we are giving is exclusively for our Health Hour viewers, where you get 199 off on online consultation with Apollo doctors and up to 20% off on medicine orders. The code is HH247. The WhatsApp number, save कर लीजिएगा Apollo 24/7 का WhatsApp number. It's 9355247247. It's just like चुटकी में आप order कर लो. Your tests are done. Your medicines are just a call away. You can call or text on WhatsApp to avail healthcare services. The number, I repeat, 09355247247. Next week we are going to talk about an interesting subject, a common subject that many of our Indian population is struggling with: piles. Piles and hemorrhoids के बारे में हम बात करेंगे. The remedies, surgeries and beyond, the care that one has to take, the lifestyle modification, the management, all the other kind of issues which can create piles and hemorrhoids, and the problem के लिए treatment क्या options है, what are the surgical procedures, और हम लोग क्यों डरते हैं इतना piles के surgery के साथ. So let's understand more of the problem. And here I am looking at the participation from our audience. So yes, question के number आप कर दीजिए. Whoever's typing, if you are typing true, please do type which question you are typing the answer for. So let's see. The winners are Pradyuman, Krish and Shankar. Today's winners are Pradyuman, Krish and Shankar. Thank you so much. Please do write back with all your contact details at marketing@apollo247.com before Wednesday of this week, and gift vouchers will be shared with you. Thank you all for joining us. We shall see you next week, and the next week's subject, as I've announced, is very interesting. We shall see you 11 a.m. next week. Namaskar.